Hi, my name's Haley. I'm a nurse practitioner student with Athabasca University, and this is my fictitious case presentation for assignment 1. SC is an 11-year-old Caucasian male presenting to the clinic today with his mother with a chief complaint of sore throat for 3 days. SC has been my patient at the clinic since he was 3 years old. His mom states that he's complained of a sore throat for about 3 days. He's had decreased appetite for the past 2 days and has a slight dry cough today. He's been lethargic and grumpy and has had a fever of 38 the past 2 days. Mom kept him home from school today to bring him into the clinic to be assessed. SC explains that his sore throat is worse today than it has been. He describes the pain as sharp, especially when swallowing and talking. He rated his pain as an 8 on a scale of 0 to 10. He says his ears are sore, and upon questioning, he describes them more as feeling full and plugged. He states his pain is better when he's eating ice cream or popsicles, and after his mom gives him medicine. He says the pain is worse with eating and with talking. Mom states she's given him 12 milliliters of Tylenol twice daily for the past 2 days. She says his fever was controlled and pain was improved for about 3 hours after taking the Tylenol, but she was afraid to give it to him more than twice per day because she didn't want to give him too much. He states he's been very tired the past 2 days and was not able to play soccer with his friends last evening because he didn't feel well enough. His mom states that no one else is sick at home, but she thinks strep throat may be going around at school. SC has no significant past medical history. He had been diagnosed with strep throat 2 years ago after being away to a hockey tournament. He was treated with Pen V and it resolved with no issues. He fractured his third distal phalanx when he was 8 years old playing hockey, and it healed with no issues. He suffers from seasonal allergies. His older sister also suffers from seasonal allergies, and she's been diagnosed with asthma. Dad also has asthma. SC does not take any regular prescribed medications. He's been taking 12 milliliters of Tylenol twice daily for 2 days. He experienced a severe rash 4 years ago after receiving sulfa and has been diagnosed with a sulfa allergy. He's a generally healthy, active 11-year-old male. He attends school, plays hockey in the winter, and baseball in the summer. He lives at home with his 14-year-old sister, his mom, and his dad. His mom's a nurse, and dad owns a construction business. He has good support systems and no social issues to note. On exam, his general appearance shows skin that's pink with no visible masses or lesions to the face or neck and no cyanosis. He appears visibly fatigued, but he is alert and oriented. The conversation is appropriate. He weighs 37 kilograms and has not had any recent weight gain or weight loss, and he's in no acute distress. His vital signs are stable. His blood pressure is 100/72. His heart rate is 85. Respiratory rate is 18. And his oxygen saturation is 99 on room air. His temperature is 38 degrees Celsius, and his last dose of 12 milliliters of Tylenol was about 2 hours ago. His respirations are symmetrical and regular, with no increased work of breathing. There's no stridor, no audible wheeze, and no accessory muscle use. His chest wall is non-tender to palpation. There are no areas of increased, decreased, or absent tactile fremitus, anteriorly or posteriorly. His breath sounds are clear bilaterally to the bases, with no adventitious sounds, anterior, posteriorly, and over the right middle lobe. His cardiovascular exam reveals a normal S1 and S2, and there are no murmurs, and he has a regular heartbeat. Inspection of the ears shows no deformities, masses, or skin lesions. No pain with palpation over the mastoid or while pulling on pinna or putting pressure on the tragus. His otoscope exam shows ear canals that are free of foreign bodies and cerumen. His ear canals are slightly erythematous bilaterally. His tympanic membranes are pearly gray bilaterally with a visible cone of light. There's no exudate or perforations. His nose is symmetrical and free of deformities. There's no tenderness or masses. On exam, the mucosa is pink with no inflammation or exudate. Frontal and maxillary sinuses are non-tender to palpation. His eyebrows are symmetrical with good hair distribution. His eyes are symmetrical with no masses, lesions, edema, or discoloration of the eyelids. There's no visible tearing. His conjunctiva is clear with no discharge, swelling, or nodules. Pupils are equal, round, and reactive to light and accommodation. On ophthalmoscope exam, the red reflex is visible bilaterally. Optic disc is visible bilaterally and is round and yellow in color with clear, distinct margins. Arteries are visible in each quadrant of the retina bilaterally. Lips are moist with no cracking or lesions. His oral mucosa is pink with no abnormalities. Gums are pink, no visible caries in the teeth. Hard palate and tongue are pink with no lesions. There's erythema is visualized postpharynx, and there's 2+ tonsillar edema with white exudate on an erythematous base bilaterally. His uvula is midline. His soft palate rises symmetrically when he says "ah," and his voice is slightly hoarse. Inspection and palpation of the temporomandibular joints notes no abnormalities or tenderness. His neck has no scars or masses. His trachea is midline with no deviation. His thyroid gland is non-tender and it's symmetrical at rest and with swallowing. His submandibular and anterior cervical lymph nodes are palpable bilaterally. There are 3 1x1 centimeter round, soft, mobile nodes in the left anterior cervical chain that are tender to palpation. There are 2 1x2 centimeter round, soft, mobile lymph nodes in the right anterior cervical chain that are tender to palpation. And there's 1 2 centimeter round, mobile, soft left submandibular lymph node that is tender to palpation. In summary, SC is a healthy, active 11-year-old male presenting today with his mom for a 3-day history of sore throat. His past medical history is unremarkable. His physical exam today notes 2+ bilateral tonsillar edema with exudate on an erythematous base. There is erythema postpharynx. He's febrile and lethargic and has a decreased appetite. He has enlarged and tender anterior cervical lymph nodes bilaterally and right-sided enlarged submandibular lymph nodes. He has no complaints of headache. His eyes, ears, nose, and respiratory exam is unremarkable. The assessment and plan are not included in this assignment.